One.
Hi, welcome again. This is Adrian, and you're watching Peace of Mind on Channel 5. Today we have Dr. Shawna Wright with us from Southeast Kansas Mental Health, and she's going to be talking with us about some of the wonderful things that are available to us as a community with Southeast Kansas Mental Health. And thank you for coming in today.
Thank you.
Is it okay if I call you Dr. Wright, or how do you prefer I refer to you?
You can call me Dr. Wright, or you can call me Shawna. Either is fine.
Okay.
Shawna is fine.
Okay, Adrian's fine then. Okay. All right. Well, tell me a little bit about yourself and what it is that you actually do.
Okay. Well, I am a licensed psychologist. I'm not originally from Kansas, but I've been here in Kansas, practicing in Kansas for about 10 years.
Okay.
I work with the Southeast Kansas Mental Health Center, and I provide outpatient therapy to a wide range of clients. I think my youngest client right now is 3, and my oldest is about 72. So we see a whole
72.
range. Yes.
Great, great. So you are a doctor. And you said you're a psychologist.
Yes.
Now, can you kind of give us an idea of the differences between like a psychologist and a psychiatrist, that sort of thing?
Sure. We both have graduate level training, meaning we went to school after we received our undergraduate degrees, but I am not a medical doctor. So I have a doctorate in my study of psychology and the treatment of mental health disorders, but I'm not a medical doctor. The biggest distinguishing factor there being that I cannot prescribe medication, and as far as mental health treatment goes. And typically psychiatrists, they evaluate and determine if a medication is appropriate for mental health disorder, but oftentimes they don't do therapy. They don't do the talk piece of it to help people learn coping skills and to process issues that might be related to their mental health issues.
Okay, so to kind of get an idea, you don't prescribe medication, but they don't necessarily do the talk therapy.
Absolutely. Now some do, but most don't.
Okay. So for my own reference, do you have a couch in your office? So is it like the old TV shows, or?
Actually, I have a couch in my office, but it's not comfortable. I've rarely had anyone come in and lay down on my couch. Typically, we use the couch if we've got a family in there and we have people sitting together. But it's not like you see in the old TV shows. No.
Okay. So don't go to the Southeast Kansas Mental Health to feel like you're going to lay down and.
No, not unless you want to bring your own pillow and get a little more comfortable. Our couches are pretty rigid.
Okay. Okay. Well, give me a little bit of an idea of why somebody would come to Southeast Kansas Mental Health. Is it something that they just all of a sudden feel, I'm going to go to Southeast Kansas Mental Health? Is it something where they get referred from maybe a family doctor, or how does that usually play out?
We have new clients and clients that walk through our doors for various reasons. Oftentimes it is a referral from a doctor that's picked up on symptoms, whether that be anxiety or depression. Oftentimes it'll be a parent that's noticed some changes in their child's behavior that have been persistent, and they'll call and say, I don't understand what's going on. Can we, talk about what's going on? Is this mental health issue? Is this a behavioral problem? And children, we treat behavioral disorders as well as mental health disorders, but sometimes we're referred through doctors, and other times it's people just saying, I feel really different. I'm not me, whether that's because of depression or anxiety or not feeling like getting out and living their lives the way they have. So they'll call and say, hey, I'm not feeling normal. There's something going on and I don't think it's medical. Can I come in and talk with you?
Okay. You mentioned something kind of important there. Sometimes people will say to themselves, I'm not feeling normal. Well, sometimes we have ruts that we get into, or we have bad days, or is there a way that we kind of distinguish what is a bad couple of days and what is something that is a mental health concern?
Absolutely. And using the word a couple of days is really a good anyone can have a bad couple of days, and anyone can have a bad week or two, but if we see symptoms go on, whether that's just a depressed mood that persists, or losing your appetite, not sleeping well, that persists beyond about 2 weeks, and it starts to affect your functioning to where maybe you're not going to work, or you're late to work, or your grades are falling at school, and we see those symptoms affecting your functioning, then we know it's probably time to talk to somebody.
I kind of talk with my clients to see where they're at. Not that I try to diagnose where they at, but I tell them if it's healthy to have certain fears. Certain fears keep us safe.
Right.
But if a fear of a spider, let's say, keeps you from leaving your house on the off chance that you might see a spider, then that's
Right.
something where you might want to see a mental health professional.
Absolutely.
It's kind of a exaggeration, but it's a little bit kind of like what you're talking about there.
Right.
So what are some of the services or programs that might be available at Southeast Kansas Mental Health that might help some of our viewers have peace of mind?
Sure. We have a variety of services through the Southeast Kansas Mental Health Center. Primarily, we do therapy, and that is offered to all age groups. We don't exclude anyone, and we do family therapy as well. For those clients who suffer from more severe disorders, we also have case management services. And basically, we have a child's program and an adult program. We break those services up. In our children's program, we try to help restore children to average everyday functioning, to where they are functioning just like their peers. And we do a lot of community-based work to help them build skills and cope in the moment. And with our adults, we do the same thing. However, our adult case managers really do focus on helping adults learn how to advocate for themselves and find resources to help themselves if they're just in a really bad spot. And that can be everything from obtaining resources for housing, helping them find resources for employment, returning back to school. It's more of a resource finding service. So I need to be clear that we don't provide housing or provide those fundings, but we help individuals who are struggling to meet those goals if they qualify. And qualifying means that we have a severe disorder, not a temporary or more acute disorder, if that makes sense.
Well, that does make sense, and that's actually, a wonderful thing that you do, and that's why I started doing my own show, is that there are so many services out there in our community. We don't realize that they're available, and because we don't realize they're available, they don't get utilized. When they're not utilized, sometimes we lose those things.
Right.
And so it's good for those services to be available. So if that meets your criteria, then make an effort to come on out to Southeast Kansas Mental Health and see what might be available to you, and not have all that stress and worry associated
Absolutely.
with finding a house if you also have any of these other conditions along
Right.
with that.
Our case managers are great at finding local resources. In all of the counties where we work, they are just in tune with the resources in the local communities and can help facilitate a lot. We also have a psychosocial program for adults and a psychosocial program for children. And again, we try to help those individuals in a group setting kind of feel more comfortable in applying social skills and integrating ways to find support and not be alone if they're struggling with a mental health issue. So we have programs for adults and children in the group setting as well.
Now, some people might be hesitant because they heard psycho, they didn't get the social part of it, and so a lot of times we have a fear of being labeled. If I go into this building,
Right.
who's going to see me? What are they going to think of me? Is that going to affect my job? Things like that.
Right.
Is that a noticeable problem that you see happening that might limit people from coming for counseling?
Sadly, yes. That is the stigma associated with mental health often does keep people from walking in the door. I've even had a client tell me, I sat out in your parking lot and read the sign for about 10 minutes before I was able to come in, because just reading that, I thought, what do I label myself if I walk in the door? And that can be a barrier definitely for people coming in and seeking services.
So that's one way to look at it when you're looking at that sign and questioning those things. But what should people actually be thinking about versus how am I labeling myself? I know with my clients, we don't focus on the stressor. We perceive the problem from a different perspective, and we are able to approach a solution
Right.
based off of that change in perception. So
Right.
what way should they be looking at that sign instead of labeling themselves?
Oftentimes, I'll encourage clients to think of our office and our setting more like the medical setting. When you walk in the door of a local medical clinic, you might be sitting next to someone who has a cold or someone who has a chronic disease, but everyone's there because they want to be better and they need treatment. And the same is true with the mental health setting. You might be walking in and someone sitting next to you might be suffering from a grief-related issue, and we might have someone there that has a more severe diagnosis, but you don't label yourself by walking in the door. You're probably for maybe 5 minutes in the presence of others who are saying, I'd like to be better, I'd like to feel better, and that's why I'm here. And that's one of the things that I try to do to help people shift that perspective, is that any and all of us can hit a point in our life where we need some support, or we need someone just to give us some education and some coping skills. And there's a wide variety there. Just because it says mental health on the door doesn't mean that you're labeling yourself, if that's...
And the very interesting thing is that people will do that. They will sit there and add to their stress,
Right.
add to their worries, and not get the attention they need. And so many times there's a phenomenon that I've been reading about that no-show or canceled appointments for doctor's offices, that people will feel bad enough that they will call to make an appointment. And then once they've made that appointment, once they know that, okay, I'm getting the attention that I need, they start to feel better.
Right.
Because they've let that pressure off themselves. They've left that concern of what is wrong with me off themselves. So don't limit yourself by not going in and finding out if this is something that's right for you. If you've made it, especially to the point where you drove to the parking lot.
Absolutely.
I know we joke around about how uncomfortable the couch is, but
Come on in and sit on it.
the furniture is probably more comfortable than in your car.
Right,
So
right.
you mentioned being in the doctor's office, and that just kind of got me to thinking, how is the relationship between, say, mental health providers and regular health providers?
Right. My answer to that would be, it's not as good as we'd like it to be, but we're working on it. What we find is, if we can work as a team and have a collaborative approach to treating an individual, then the individual is healthier in general. Oftentimes people don't realize, if they've been diagnosed with something like diabetes or cancer or a chronic illness, depression or anxiety often go hand in hand with that. And if we can help that individual get through the door, help them cope with those symptoms, then their recovery and their treatment for their medical-based issues really improves. And so it's really important that we collaborate with doctors, and we're working really hard to improve that in our setting right now.
So we know that stress, if not is a cause, it exacerbates existing causes, and is, I think the studies show, like 80 to 85% of the reason why somebody ends up seeing their family doctor. And so if they have a troubling situation, even if it's not mental health related,
Right.
that stress is something that mental health can help with. By reducing that, we allow our bodies to help heal itself.
Right. Absolutely.
Very good. That's a very important thing to take note of, is that a lot of times we get in the way of our own healing process because we don't try to find ways to deal with stress. What other aspects would somebody, say like myself or my viewers that may have no experience with mental health might want to know? Like, well, one thing is next month, I almost forgot about this, next month is Mental Health Awareness
Mental Health Awareness Month, yes.
And is there anything going on at Southeast Kansas Mental Health that might be associated with the Awareness Month?
We typically try to engage our therapists and our clinicians in writing articles for the paper and doing outreach projects in the community. I'm not sure if we have our whole agenda down for the month of May, but we try to have more of a presence, just publicly letting them know that our services are available and making an outreach to the community. Sometimes we'll talk to professional business groups, sometimes we'll talk with educational groups, let them know about our services and help them understand. Every once in a while we'll have a group like the Boy Scouts that will go in and meet and talk with them about childhood disorders and help facilitate. And I don't know if we have that set up for May with the Boy Scouts, but we've been working with them. So we try to beef up our outreach in the month of May.
So any of our viewers that are just hearing about this, is there an opportunity that if they have an organization or a program that they might be able to have you guys come out and do
Absolutely.
something with them? maybe May, maybe later, a different month?
Sure, absolutely.
And who would they contact?
Our best contact would be Becky Stanley in Iola, in our Iola office. She kind of manages our outreach efforts, and so she would be willing to take those calls.
And I know personally that if I walk into Southeast Kansas Mental Health here in Chanute, that they have an email contact and the Iola contact information to get a hold of Becky Stanley for something such as that.
Yes.
Good, good. I talked to Becky, and that's how we got in touch with each other, and she seems like a very, very nice, very pleasant person to talk
Absolutely.
with. Besides the what you do in Southeast Kansas Mental Health Building over on Kansas, the address is again?
402 South Kansas here in Chanute.
402 South Kansas. Besides that, I hear that personally you're involved with some other projects that also help people here deal with different stressful situations.
Absolutely.
And maybe you'd like to share with our audience a little bit more about that.
Well, sure. My husband and I are involved in a program called Marriage for Keeps. And we just launched our first program here in Chanute this month in April, and believe it or not, we're not doing one in May, but we're looking to do one again in June. And basically, it's a marriage enhancement program. It's going to run on 2 Saturdays in the month of June. It's a free service to any interested couple. We do ask that they're committed couples, whether they're engaged or they've been married or in a committed relationship, so that everyone's kind of, from the same background with the same, investment in enhancing their relationships. And we go over communication and problem solving skills and do what we can to help them learn how to really enhance the relationships that they already have.
And I don't know how many times I go to, say, Walmart or a restaurant or any number of places, and I see it, whether it's because of my previous training as a police officer or what I do now, or maybe it's just my relationship with my wife, but I see the way that couples interact with each other, and it seems like so many people could benefit from a project like that or a service like that.
Right.
So how would they get a hold of that opportunity?
Well, I have a phone number I can share with you. I don't know it by heart. Is there a way that I could share that with you or share that with your audience?
Yeah, I think what we'll do is if we give that information to Chris,
Sure.
he'll have an opportunity to put it on
Great.
on the
Great,
program.
but it's called Marriage for Keeps. I brought a contact sheet for you, but I do not know the number by heart because it's
That's
not
okay.
contacting me personally, but because we are working with an agency that's received a grant to bring the program to our area. And we're hoping to get that set in stone for June. We'll have another date, a couple of dates, but we launched this month and we've had a really good, we've enjoyed it.
And how many couples, what kind of room do you have for participation
Well,
in
the
this?
hospital's been kind enough to lend us a room, so we have the learning center there at the hospital. Right now, we have 2 couples. That was our kind of test stage to get started, but we could take anywhere between 4 to 8 or 9 couples. And if it's a success, then we'll continue to offer that. We'll hope to offer it at least 2 to 3 times a year, regardless. But if it's successful, we'll make those opportunities ongoing and available.
And is there a limitation to who can participate in that, as far as like they have to live in Chanute and Yosho County, or they just have to make it here on the days that you have it?
Well, it's a grant-funded program, and to be honest with you, I don't know the answer to that. I can tell you I would welcome anyone who came through the door. We have a registration process that's very simple. When you call the number and say, hey, I'd like to go to this upcoming program, they'll say, okay, this is when you need to be there. It's fun. The 2 days that we do the project, whether we meet early in the day, then your lunch is free. If we meet later in the day, then we provide dinner for the couple on both days that they attend the program. We also give away gift cards. We have some activities that the couples participate in, and it's not a competition by any means, but there are some fun incentives as well.
Some fun things to keep them engaged, basically.
Absolutely,
yeah.
absolutely. And so I would tell you, my gut says we'll welcome anyone that comes through the door. If you're able to get there and participate, then I think that would be fine.
So a little peace of mind, if I can plug my show again, is that you don't have to go and sit in a lecture series.
No.
Yeah, this is not somebody preaching to you. It's a
No.
very interactive
Absolutely.
process. And I mean, think about it. There's a win-win scenario here. You learn some techniques, you learn how to communicate with the person that you feel committed to, and you have less stress. Less stress, you don't have mental health issues, you are able to heal your physical issues better. So it sounds like a great opportunity.
And it can be really validating to see that there are other couples that have the same issues that you do. Oh, this isn't abnormal. Other people deal with this, and there is a way to address it. A lot of the things that come up in the program, people walk away going, okay, this isn't a problem for us. This is normal, and we can get through it. It's really a neat environment.
That sounds wonderful. I wonder if I can just jump back a moment. We talked about, maybe a parent sees a child, a behavior that's ongoing. I kind of wanted to address that and address maybe elderly parents, because sometimes we see behaviors in elderly parents, or maybe gaps in thinking process and stuff like this. A parent notices this. Is there a wrong first step as far as I want to get this investigated? Do I take them to my primary care provider? Do I take them to Southeast Kansas Mental Health? What would be the best first step?
Well, I would recommend consulting with your medical doctor just to be sure. I mean, even problems that we treat, where if a child has, for instance, a bedwetting problem, that can be something that we treat at the Southeast Kansas Mental Health Center. However, we'd always want to medically rule out, is there an infection or a medical problem? So we'll refer you out if we feel like we need some medical clearance before we proceed with behavioral or mental health treatment. But really, our doors are open. So if you come in and we say, we need to have some things medically cleared before we proceed, we're going to let you know that. If you're feeling like it's more of a behavioral issue and your doctor says, okay, well, we can try this prescription or this treatment, if you ask them, they'll refer them over. Oftentimes, I think doctors concentrate more on the medical end of things and try to address things medically. I'm not sure. I guess if you're interested in therapy or want that approach, you probably need to mention that to your doctor just to make sure that they feel like that's appropriate.
Okay. And probably a lot of doctors are probably thinking the same thing that we discussed earlier. Well, they're coming to me because maybe they don't want to be labeled with a disorder. Wish there was a way we could soften the language, but it is what it is. We have to use certain terminology because it's expected in in our professions and in court law instances and things like that. Insurance requires certain things. There was one other question that I had that is not on the form, and I'm probably going to shock you with this. We kind of discussed a few questions before. I hear a lot about changes to the diagnostic manual that are coming down the line. I think the final stages aren't even out yet. How do you deal with the frustration? I'm sure that's changing the way things are looked at by the sounds of it. Certain things are no longer included, other things are included. I hear that some of these changes are to try to encompass more people to get them assistance when they're needed, versus trying to take over the world with labeling everybody as having a disorder.
Right. And I'm a roll with the punches type of provider. And so right now, my first step in that is just to become educated on what those changes are and make sure that I understand all of the diagnostic criteria that go along. And that is quite a bit. When we look at that diagnostic manual, it's a thick manual. And there are some positive changes coming in there. Right now, for the elderly that might be really suffering with grief, the loss of a spouse that they've had for 50 or 60 years, that grief can become so overwhelming that, of course, it could be labeled as major depressive disorder. But right now, there are some criteria that elderly person might not meet. They might not meet enough criteria to say this is major depressive disorder, yet their functioning is impaired by their grief because it's so profound. And my understanding is that the new diagnostic manual has, enveloped that to say, no, this person probably could benefit from treatment, and maybe insurance should even pay for that, so we need to legitimize it. The other category that I'm aware of that we might see some drastic changes in is PTSD. And I think that's a positive for our war vets that are coming back from Iraq and Afghanistan, because there isn't just a cookie cutter symptomology for some of these men and women, and being able to broaden that and encompass a wider variety of symptoms and not really narrow down that diagnosis could help people get the help that they need.
And just like anything else, as science evolves, as our understanding evolves, there's been changes to things like PTSD. At one time it was shell shock, and I think there was another change in term after that. And so, like I said, it's a roll with the punches in order to try to be able to best address the needs of the patient in this situation, I guess. Well, that is good. That's wonderful. So we don't necessarily have to look at changes in mental health care as a threat or a worry or a concern. Look at it like that sign out in front of Southeast Kansas Mental Health. This was an opportunity for me to get better. And that's what's important to each of us, to you and to us as somebody who tries to help people with stress, or in your situation, more than just stress, those things that limit people on a functional level.
Right.
So is there any other thing that you would like to discuss with our audience? Any maybe other programs that might be available, things that might be coming down the line, or anything else that they might be interested in hearing?
Well, I would like to mention that we do have a substance abuse program as well available through the Southeast Kansas Mental Health Center. I'm not a substance abuse counselor, and I can't talk to you in depth about what that process is, but we do have that program, and it's available to any of our clients that might need that. And we also have a crisis department. We have crisis workers that work throughout the day and night, and we are available for those who might be in crisis. If they feel like they might be, anyone that feels like they might be in danger of harming themselves, or might feel like they're, at the end of their rope, we have people that are there to help immediately, just by calling the local phone number.
Okay, great. Well, I would like to also mention that that Southeast Kansas Mental Health is going to be at our Children's Health Fair on June 8th, and there's a really wonderful technique that you're going to be sharing with kids.
We are going to be training that diaphragmatic breathing with children, and we're going to have bubbles out at the table because children just love bubbles, and we're going to use that as a tool to help them learn how to control that breathing and help them experience the difference in their level of excitement and energy based on how they're breathing.
And for any of those who had seen me when I was a guest on Betsy's show, you know how important I feel that diaphragmatic breathing is. So I want to thank you for being on this show. You're a very pleasant person. I don't know why anyone would hesitate to come see you at Southeast Kansas Mental Health. I just remembered one other thing I was going to ask.
Okay.
Will they be coming to see you at Southeast Kansas Mental Health, or do they come in there and maybe instead of a psychologist, they might find somebody who is maybe a licensed professional counselor or a licensed marriage and family therapist? How does that play out?
We have a variety of clinicians through the Southeast Kansas Mental Health Center. We have licensed clinical social workers, we have licensed professional counselors, psychologists as well. And basically what we do is an intake process. If you want to be seen, we set you up with any of our staff for an intake. And if you feel like you're a good fit with your intake worker, then you'll stay with them. But if you have a special need, or if you have a diagnosis that we have a specialist in-house, then we'll refer you over. We have someone in our Chanute office that really does specialize with PTSD and the more anxiety-based disorders, and if we feel like you need that, we'll transfer you to him. I do a specialized therapy called parent-child interaction therapy, and I work a lot with families that are trying to build those parent-child bonds, or families that may have had their children removed, placed in foster care, and I do that rebuilding work. And I'm the only one in the office that does that, so I get those referrals. We have a specialist that focuses on abuse in children, and she gets a lot of those referrals. So basically, you'll come in and work with an intake worker, and that's something I think is important for anyone that's considering mental health treatment to know, is that very first appointment, you don't get therapy. It's an intake. We want to learn all about you. We want to learn what's going on, what some of those triggers for your symptoms might be. And if we've developed a relationship there, you'll probably stay with your intake worker. But if we see a specialized need, we're going to refer you to the person who can help you the most.
And that intake is so very important. I know with people who call me for services, they think that they come in, I wave a magic wand and they leave fixed.
Right.
And so much, it's not, we've become a society of expecting immediate gratification.
Right.
And it's not immediate gratification. It is, we want to learn more about you. We want to find out what is going to help you make those changes and really devise a plan based on the person. And it sounds like that's what that you guys do in that
Right.
intake as well. And that is so very important for that. Now, one other question that we have is from one of our viewers. And does insurance cover services provided at Southeast Kansas Mental Health?
Almost all. It depends. Now, we see clients with Medicare and Medicaid and almost all of the third-party, insurers in the state of Kansas. Now, some of the more private insurances like Blue Cross Blue Shield or Aetna may require a pre-authorization. That is not a complicated process. If you come in and do an intake and the therapist says it's medically necessary that you have treatment, we send in a request to the insurance company. So yes, we receive insurance payments, but I think it's also important to, thank you for bringing that up, because the Southeast Kansas Mental Health Center also works on what's called a sliding scale fee. And so if you don't have insurance but you feel like you need treatment, we'll look at your income. We can even, if you want to share your bills with us and look at how much disposable income you have. We have clients that have been seen for as little as $5 for a session, depending on what their income is. So we don't want anyone to be turned away based on whether or not they feel like they can afford it. So yes, we accept insurance. Insurance does cover most. There are some disorders it doesn't cover, but if a therapist says, I believe that you need treatment, then they know that they're going to be able to work with an insurance company so that that's reimbursed. And we do have the sliding scale fee.
Great, great. Well, I think that's about all the time we have today. I just wanted to, let you know out there that there are programs available for you. There are people that are willing to help here in Chanute. Really anyone. If you come in and just ask the question, how do I get help? Is this something that's right for me? Don't let things like finances, like how people are going to look at me, how am I going to be labeled, will this affect my job, things like this. Don't let those things keep you from getting that peace of mind that we so much desire, so terribly need in our lives, to bring our stress levels down in order so that we can become able to function normally again in society and just have a happier life because we allow our bodies to heal itself. Thank you again for watching our show. This is Peace of Mind. Have a good day.